Hey guys, am I audible, visible? If so, say me a hi, hello. How many of you are online? Hello, Nai, good evening. You're back here again. So, can you guys hear me, see me? If so, say me a hi, hello, so that we'll start. I hope I'm audible and visible as well. Hello, Priya. So, let's start again with the RRR series. I'm going to jump to the second chapter. I'll be completing the entire second chapter in RRR because I feel that the second chapter, the inflammation, is one of the most important. The simple reason, once you go to your systemic pathology or any disorder in any organ in our body, half of them is going to be inflammatory, right? Good evening, Piyush. I'm good, Priya. Hope you're doing good as well. Okay, so it's an inflammatory disorder primarily. So if you know the concepts of acute inflammation, chronic inflammation, the way by which my body is going to respond, it's very simple for us to extrapolate things when we go to systemic pathology. It'll be much easier and comfortable for you to understand the slide, microscopic finding, everything in the pathology, right? Student will wait, we'll come to it for sure soon, right? Good evening, Rahul. So what I'm going to do is, if you look at Robbins, is in Robbins PDF. There are multiple places in Robbins which are redundant, or I wouldn't say redundant. You will definitely know that once you finish your second year of MBBS. I'll just underline a few things because first few pages of Robbins has more information, which I'm sure every student easily can write it after you complete pathology. Fine. Good evening, Lion. So these are not much important for me, but it's required since then Robbins will quickly go through that, right? Before going there, I want you guys to tell me what is inflammation. All the very best, Trutella. You'll do amazingly well. Have trust in you. You're going to rock the paper. I hope the first paper went well. What do you think is inflammation? Can you guys define in your own terms? Anything which comes to your mind. Okay, this is what I think about inflammation. You have an definition there. I don't want the definition. Perfect. I want answers like whatever Sunshine said. Swelling. That's enough for me. Sure, I'll do it. Body's response to anything foreign substance, right? That's all, right? It's swelling. It's one of the signs of inflammation. If you look at Robbins, it will be detailedly written that inflammation is in response to a vascularized tissue. That's it. Only a vascularized tissue can respond to an inflammation, right? So what Robbins exactly says is it's a method of host defense where there's a site of infection or an elimination of an offending agent. This for me is a very small purview of inflammation. This is the one which I'm pathologically really worried about. That's the goal of inflammation as a doctor. But inflammation is a very broad topic. We had discussed last time somewhere that when we were discussing about pigmentation, I asked you a question that I'm sure most of your parents would have told, don't go and play out in the sun, you'll become dark. That actually is an inflammatory response. Because whenever inflammation happens, my skin will respond by producing pigments. So UV rays is not going to cause tissue damage visibly, but it is definitely inflaming my body, right? Anything which may foreign my body, which I'm not born with, if I'm going to have it, that's inflammation, including your dress. Dress also elicits inflammation in the body. I can prove it easily. If you are wearing tight pants, right? If you're wearing tight pants, can I say the hip line will become dark? How many of you noticed it? If you're wearing tight pants, the entire hip line will become dark. That also is an inflammatory response, right? It's just an inflammatory response. Anything which irritates my body, to which I'm not born with, it's not a component of me, which is foreign, my body will react. That's what is inflammation. That's a simple thing about inflammation. My Robbins covers the inflammation which I need to know as a doctor, an infectious or an offending agent or anything which is foreign. The response by a vascularized tissue is called an inflammation, right? So inflammation, if you're going to take the inflammatory process of just the response to an foreign tissue, it's on PW method, you can have that, right? So here, let's assume as an example, we'll go to this image of Robbins. I'm just going to ask you a question. You are having a bacteria coming into the body. What do you think is the first step of my body? I should recognize the bacteria, right? So the first step of inflammation, there are sequential steps in inflammation as per Robbins. The first step of inflammation is recognition, right? I have to recognize the bacteria or anything offending, I have to recognize it. It's not very much important to remember these steps because like I said, you'll definitely know these steps once you finish Robbins or second year. It's self-explanatory. For me to identify it's a foreign, I have to recognize that. We will see about the recognition when we come to the immunology chapter. There are few receptors. We'll definitely learn about that, right? Perfect, Kamran. Toll-like receptors, not-like receptors, all those things, right? So after that, I have to recruit the WBCs. My WBC should come to that area. That will be seeing in subsequent classes where I have something called enrolling, addition, diaperesis. I'm going to recruit the WBC site of inflammation, and who helps in the recruitment also we'll see, right? This is just an overview. I'm just going with the headings. so that we will, once we go to the depth of it, we'll explain this in detail for sure. Then I have to remove. Again, when we read about acute inflammation, we'll see how we remove that. Good evening, Pratiksha. Okay. Then I have to regulate and I have to repair. Repair is also a component of inflammation. Don't consider healing and repair separately. If you have an inflammation, I'll have to remove the bacteria or any offending agent and my body should heal. Healing is also part and parcel of the inflammation, right? So before, there are a few more things as well. There are multiple things which helps in inflammatory process. You have the good thing as well as bad thing, right? I'm killing a bacteria. Am I right in saying that the same thing which kills the bacteria can also kill the human body? Is that statement right? Can it or can it not? It can, right? Obviously it can, because bacteria is also biological matter. It's also a cell, right? I'm killing the bacteria. The same thing can kill the human body also, right? So this, which, if you go a little bit further down, it said that there is actually harmful consequence of inflammation also. Like the 5 cardinal signs of inflammation. Pain is harmful. Pain is definitely pathological for me, but I need to have that. Fever is not good for me, but I need to have that. It's a protective response, but I need to have that, right? So all these are harmful consequences of inflammation. Now, I want you to ask you a simple question. How many of you think fever is bad? How many of you think fever is good? See, you're all good students. I want you to move to good doctors. There's a huge transition, and the transition is very, very important for us. Fever is good or bad? Fever is absolutely good, right? Perfect. Because the role of fever is to eliminate the organisms, right? It has to eliminate the organisms. Fine. Perfect. So fever is good and high fever is bad. Perfect, right? So that's what inflammation, every inflammatory pain is good to some extent. It's bad. So now the question comes, when do you guys will give paracetamol to a patient? When will you give paracetamol? When do you think you'll give paracetamol? Because it's a sign of inflammation. Everyone knows that my body is responding. It should be more than or equal to 100 degree Fahrenheit. Below 100 degree I should not give. Below 100 degree is completely fine. Even in infants is completely fine. There are guidelines which says that wait till 101, wait till 102. If the kid is becoming very not eating, not playful, then give it, right? Because beyond 100 is only then my metabolic derangement of cells start happening. So the reason for knowing inflammation processes, I need to know when to intervene. Because don't intervene every time. You won't let the body learn at all. The body should learn, because body needs to fight the organism in the absence of medical job, right? So let the body learn. These are all effects of inflammation. Inflammation will have harmful consequences for sure, right? We already know quite a few of them, and Robbins has enlisted it here. We'll read them in different parts of the total symptom. The harmful consequences can be both local and systemic. That's why the cardinal signs of inflammation comes into play. I love this image. I've shared this on Instagram as well. This is from an old article. Amazing image, right? Textbooks are really, really good. The only thing is we're not reading the good textbooks. That's a problem, right? You have heat. Heat is your calor. You must have read about calor. Redness is your rubor. Okay. This is tumor, swelling. Okay. This is pain, dolor. The name Dolo 650 came from dolor. That's analgesic, right? And this guy is not holding the bridge or holding the top one, right? That's loss of function. Okay, that's functionalasia or functions loss. The loss of function. This is true for everything. Every inflammation, I'm going to have this cardinal signs. When you have arthritis, arthritis is inflammation. Knee joint will swell, knee joint will pain. If you touch the knee joint, it will be warm. And obviously, you will not be able to move the knee joint, right? So this is true for everything. Yes, Rudolf Virchow gave the functionalasia, and if someone is going to go very theoretically, these first 4 signs of inflammation were given by a person called as Celsus. We call them Celsus sign of inflammation, and this was given by Virchow, Rudolf Virchow. He was considered father of modern pathology. Again, I hope my seniors will stop asking these type of questions, and when you guys become senior, please don't ask who is the father of modern microbiology, pharmacology, medicine, surgery. I don't want to know. I don't want you to know. That's not required from a doctor, right? Our goal is only one. Please ask any questions to your juniors pertaining to that one goal of learning medicine, with the goal of treating patients and managing patients. That's it, fine. Now, let's go to type of inflammation. There are 2 different types. Everyone knows this, acute and chronic. Acute inflammation, obviously it's going to be for hours, months to hours, right? Minutes to hours. Chronic inflammation can be for days, years, sometimes even decades. Can have inflammation which can be even there for decades together, right? Hallmark. Both acute and chronic inflammation is hallmark. We will understand the acute as well as chronic inflammation hallmark with a simple example which all of you can relate. All of you had pimples? You crossed the age, definitely you must have had pimples, right? So when there's a pimple, at the starting point of a pimple, will there be a swollen bleb on the skin? Definitely be swollen. That's my hallmark of acute inflammation, right? It's increase in vascular permeability. It becomes red, it's swollen a little bit. That's in vascular permeability, right? Definitely your mother would have told, don't pinch the pimple. That's what your mom would have told. We never listen to our mom. We never listen to our parents. What do? You pinch the pimple, you make an acute inflammation chronic. When it becomes chronic inflammation, after you damage the pimple and everything, can I say it will become a scar? If you don't touch a pimple, it'll have an inflammation, it'll subside totally, right? If you touch, if you fiddle with it, will it become a scar? It does become a scar. The blackheads, a scar, and a product of inflammation, that's all. Any chronic inflammation, there will be tissue destruction. It will destroy the tissue and it will heal by fibrosis for sure, right? Like Rahul said, TDHF is my favorite thing in my entire medicine career. Tissue destruction, healing by fibrosis. No, Rahul, that's totally different from this, right? This is Propionibacterium acne. Acne is a bacterial infection, tiny infection of the skin hair follicles. It will automatically subside. If I go and fiddle, it will heal with fibrosis. Every chronic inflammation will heal with fibrosis, right? Okay, right? So the cell of acute inflammation is neutrophils, and the cell of chronic inflammation is macrophages. Okay, so the lymphocytes are also a cell of chronic inflammation. Generally, we consider that lymphocyte to be the cell of chronic inflammation, right? Lymphocytes are cells of chronic inflammation if the etiology of the chronic inflammation is virus or autoimmune. Only then lymphocytes come as a primary role. There are lots of causes of chronic inflammation apart from virus and autoimmune. For all of them, macrophage will be the cell of chronic inflammation, right? So now we know this. This slide is very, very important. If possible, take a screenshot, keep as your mobile wallpaper. I want you to remember this till you are practicing medicine because this helps me to easily understand any slide in microscopy. Sonak, we have a TND. By 9 o'clock, I'll come live and tell you how it has been structured and what to do and everything. Just I'll come on YouTube and explain everything, fine? Okay. So now let's look at this part, this half of the slide. You guys must have seen the peripheral smear in your physiology, right? You must have. Do you remember the Newbar's chamber? The one which all of us hate, right? You must have definitely seen the Newbar's chamber. All the slides, all the cells in the Newbar's chamber on the peripheral smear also, right? You must have seen a neutrophil. You must have seen a eosinophil. You must have seen a lymphocyte. Macrophage you must have not seen, but you must have seen a monocyte, right? So neutrophil is always multilobated. It will be multilobe. Neutrophils granulated or agranulated? They are granules, right? They are granulated. Rahul, anything about next? No, don't ask me. Honestly, I don't know. No one in the country knows. Let NMC open their mouth. We'll answer that later. Okay. Eosinophils. Eosinophils are classically bilobe nuclei, spectacle shape or a headphone shape bilobe nuclei, right? And they do have a very, very reddish granules. This is what you must have read in your physiology, and also you must have seen in your peripheral smear if your pathology practicals have started, right? Reddish granule, bilobe cell. Lymphocyte, granulated or agranulocyte? Lymphocyte. You have granules or no granules in lymphocyte? You do have no granules in lymphocyte, right? Lymphocytes they are agranulocyte. A lymphocyte and monocyte are agranulocyte. I don't have granules in them, right? Lymphocyte has a single nuclei, round nuclei, very thin rim of cytoplasm. They are all agranulocyte, right? That's how a lymphocyte looks in a peripheral smear. Monocyte in a peripheral smear has a kidney-shaped nuclei. That's how monocyte look in peripheral smear. I'm not going with basophil because basophil's role in inflammation is almost negligible. We'll ignore that, right? Again, monocyte also I don't want. I want more of macrophage. We don't see macrophage in blood. We see them only in tissue, right? So these are the only 4 inflammatory cells I want you to know. If you can master this, rest everything in microscopic diagnosis is very, very, very simple, right? This is how it looks in blood, which you already know. So we are going to take your existing knowledge and apply it to biopsies, because predominant of them I'm going to see in biopsy. Except for hematology, rest every systemic pathology is biopsy, right? So I need to be excellent in biopsy as well. The concern with neutrophil is the granules of neutrophils are very, very tiny. So when you go to a biopsy, I won't see them. The lobations of neutrophils can be seen, but it will not always be this chromatin thread. I might not see the chromatin thread connecting them because they are very, very tiny. So how a neutrophil will look in a biopsy? It will look like a bent nuclei. Never forget this. Yes, Rahul, we'll see that soon, later. Okay. Nuclei, if it's bent, it's a neutrophil. A neutrophil's nuclei will be bent. What is the color of nuclei? If you're with me from the first, I'm sure you know the answer for this. It's a very, very simple question. The color of nuclei everywhere in the biopsy is going to be blue in color. If there's a blue color bent structure, it's a neutrophil's nuclei, right? So the reason why I'm emphasizing on this is, if I'm having a biopsy of an acute encephalitis, brain biopsy, can I say there also I'll have neutrophils? Yes. Acute pneumonia, I'll have neutrophils, right? Acute liver abscess, I'll have neutrophils. GI acute inflammation, I'll have neutrophils. Throughout my body, every acute inflammation slide will have neutrophils. You must have seen acute appendicitis. They must have showed you acute appendicitis in the pathology laboratory, right? Next time, if they show you, go and look at the slide, go to the higher power, see if you're seeing bent nuclei. If you're seeing bent nuclei, that's what acute inflammation is about. That's very, very important for me, right? Okay. Madhav, you tell me what is your query in Hindi. I'll try to explain in English. I'm not so comfortable in Hindi. Okay. Then, if it's an eosinophil, okay, if it's an eosinophil, don't go with the lobes, go with the granules. Because the reason I'm saying why don't go with the lobes is, you're having two lobes like this in eosinophil. If I'm going to cut like this, I'll have both the lobes, right? If I'm going to have one behind the other, there are two lobes only, but one behind the other. How many lobes will you see in the biopsy? One or two? You'll see only one lobe, because biopsy is about a cut surface. I can cut like this transverse, or I can cut like this longitudinal, so I'll have only one lobe. That's why I'm saying don't go with the nuclear lobations in case of an eosinophil. In a biopsy, always go with eosinophils granules. So if I see granules anywhere, I can say it's an allergic inflammation. Asthma, same eosinophilic granules. Drug-induced allergy, same eosinophilic granules. Just remember this. Look at the options. If you have granules, that's how it is, right? Then lymphocyte is about small round blue cell. Because lymphocyte is an agranulocyte, it will have a very tiny single lobe nuclei, just tiny blue. That's more than enough for me. The reason why this is very important for me is, let's say I'm having an autoimmune disorder throughout the body. What is the cell of any autoimmune disorder? I want you guys to comment on that. We just now saw every autoimmune disorder microscopically. I'm going to have only one cell, which is perfect lymphocyte. So can I say, be it an autoimmune encephalitis or a pancreatitis or a thyroiditis, any autoimmune disorder for that matter, in biopsy will have blue cells. That's enough for me. Multiple small round blue cells, I'm going to call it a look for the autoimmune etiology or a viral etiology. Virus won't be normally seen because most of the viruses are self-limiting inflammation. Balaji, it's a very good question. It depends on which type of hypersensitivity. Like a type 1 allergic induced is acute. When I have an acute inflammation, neutrophil is a predominant cell. But any allergic induced acute inflammation, eosinophil becomes a predominant cell. Type 2 hypersensitivity is not acute. Type 4 is not acute. Type 3 is not acute. Type 1 is acute because it's immediate. Right? Okay. So we know quite a few things about this. Yes, but that time you won't take a biopsy, Rahul. Right? Now, the only thing left out is macrophage. So how do I identify a macrophage? What do you think is the function of a macrophage? Anyone? You know the answer. Macrophages are like us. I always feel whenever I eat, I am a big macrophage. The only thing I do is I eat. Right? Macrophage also does the same thing. They eat. They eat whatever is tasty, like same like us, right? They're going to eat every dead cell. Every dead cell will have cell membrane. That's all. If you have cell membrane, what is the cell membrane made of? Of any cell, be it bacterial, be it fungal, be it human being. What's a membrane made of? Phospholipid bilayer, right? Perfect. In other words, macrophage is going to eat fat. What is the color of fat in a biopsy? Fat is clear, right? So macrophage cytoplasm will be clear. The cytoplasm of every macrophage, what you're going to see is clear. Because it's going to eat fat. That's a predominant thing which is there in the dead cells, right? So it's going. That's why we use the term foamy cells. The reason why we call them foam cells, they are foamy because they are made of clear fat, right? So this is how all the 4 cells are going to look for me in biopsy. Neutrophil, bent nuclei, This slide is very, very important for me. Eosinophil, pink granule, small round blue cell, you have your lymphocyte, and a clear cytoplasm, your macrophage. Hi Lalit. Okay, so now I'm going to show you biopsies. You're going to tell me what they are, right? Let's go with random things. I want you just to identify what cells they are. I'll just mark them. Tell me what cell is this. Anyone who's online, I want you to guys to comment. Don't worry that you'll be wrong. It's completely fine if you're wrong. What is this? That's a beautiful cell. It's a neutrophil. Amazing, right? So the same image, I'm going to show you one more cell. You tell me what it is, right? Comment what cell this is. This cell, what are they? It's a small round blue cell. That's a lymphocyte. Perfect, right? Comment. I'll show you one more cell. Comment what that is. What is this cell? What are these cells? I'm sure you are able to see the dots. I hope it is clear enough. What is that cell? That's a eosinophil. Perfect. Now you'll ask me a question. I'm seeing every lymphocyte, eosinophil and neutrophil in this biopsy. So what do I diagnose it as? Is it an acute or an allergy or chronic? Every inflammation will have every cell. I cannot say when neutrophil is coming out, lymphocyte please stay inside. That's what your body is, right? Your disease don't read textbooks. Only we read textbooks, right? So look at this. Look at this image. Tell me which is the predominant cell, lymphocyte or neutrophil or eosinophil. That's very important because everything will have every cell. Every inflammation will have every inflammatory cell, right? I'm going to go with a predominant cell. If I look at this predominant cell, I can see lots and lots and lots and lots of neutrophil. Whatever I'm circling now, all these are neutrophils, right? So if predominantly I'm having neutrophils, I'm going to go for acute inflammation. That's all. Okay. If predominantly, let's look at this image. Look at this image. Tell me what you're seeing predominantly here. So always don't go for facts white and black. In medicine, nothing is white and black. It always be there, this also, that also. I'm going to go with the predominant thing here, fine? Perfect. Here, the predominant inflammatory cell. Look at these. They are clusters of eosinophil, right? So these are all the granular eosinophil. When I see predominantly eosinophil, my diagnosis, it's an acute inflammation, allergic mediator. Always in any slide, don't go to the corner and say I'm having this, right? All the best, Bone. Become an amazing doctor and serve our country, right? Always please keep in mind, whenever you see anything in a clinical question, don't go with one finding. See what is going to guide me for diagnosis. Every finding should fit in, or the predominant finding should fit in. Only then you'll make a right answer. Because everything will have a tiny outlier. Leave the outlier, ignore it. Go for the predominant one, you can easily identify them, right? Tell me what is the predominant inflammatory cell here? What's the predominant inflammatory cell here? That's a beautiful, perfect lymphocyte, right? A beautiful lymphocyte. See, that's more than enough for me. When we go to systemic pathology, like I said, I'll complete the entire inflammation RRR. If you're with me or not with me, I want you to know this, because once you know this, you can apply systemic pathology. The same lymphocyte in a thyroid, I call the disease Hashimoto thyroiditis. That's an autoimmune thyroiditis. The same disease in pancreas, I call it autoimmune pancreatitis. The same disease in the biliary tree, I call them primary biliary cirrhosis. Anywhere I have this lymphocyte, I think of an autoimmune etiology or I think of a viral etiology. The same disease in pneumonia, I call it a viral pneumonia. Right? That's what my thought process. The small round blue cell, it's a lymphocyte. That's all, right? Tell me what this is. The beautiful cell. There's a huge amount of clear cytoplasm. That's a macrophage. So anywhere I see macrophage, I'm going to think of a chronic inflammatory process. If I see this macrophage in a blood vessel wall, I think of a chronic inflammation of the blood vessel wall. I think of an atherosclerosis. Right? It's a chronic inflammation. That's all. 94, 93. Just give me a second, I'll go to it soon. Fine. Okay. There's only one more inflammatory cell. We'll go finish that. I'll go to the page number 93 and 94 of Robbins. Fine. Is that the online page number or offline page number? Okay. Now let's look at this plasma cell. Plasma cells are nothing but activated lymphocytes. Lymphocytes get activated and become plasma cell, which all of us know. What is the function of plasma cell? Plasma cell's function is very, very simple. The function of plasma cell is perfect. It is going to secrete antibodies, right? That's all. It's going to secrete antibodies. So antibodies are proteins. Can I say protein in a microscopy will be pink in color? That's fine, right? A lymphocyte becomes plasma cell, and the plasma cell secrete antibody, and every antibody is nothing but a protein, and obviously it's going to be pink in color, right? That's how an antibody is going to be. So these antibodies needs to be secreted outside. They have to go outside the cytoplasm of the plasma cell. Only then they can go and bind to the bacteria and kill them. For a protein to go outside, you must have read that in your biochemistry. There is something called as post-translational modification of a protein. You remember dolicol phosphate, N-glycosylation, O-glycosylation, right? I remember still a little bit of biochemistry. I'm just going to add on, patch it on, that's all. So all of these post-translation modification happens in the Golgi apparatus. So this antibody has to go outside. For this antibody to go outside, it has to have prominent Golgi, and that prominent Golgi will look like a very pale area because Golgi is not attached. We call them perinuclear halo, or we call them perinuclear half, whatever it is. Right? So these are the classical findings of plasma cell. It will have a cytoplasm which is pink in color. The nucleus will be in the corner. You will have a clear area surrounding the nuclei. That's your perinuclear halo. I hope you are able to see the perinuclear halo here. It's an elongated cell with a nucleus towards the corner. I'll erase the perinuclear halo because it's much clearly seen if I erase it, right? Corner nuclei, perinuclear halo, pink cytoplasm. And if you look at the nucleus, it's not completely blue. It's light blue, dark blue. I'll just zoom it a little bit more. I'm sure you can appreciate it's not completely blue like a lymphocyte. This is a plasma cell. Keep this in mind. Let's go to lymphocyte. Can I say lymphocyte is much more darker? It is definitely much more darker, right? It's definitely much more darker. That's an heterochromatin, inactivated cell. Compare that nucleus to this nucleus, it's definitely lighter and darker, right? That's what I'm trying to say. It's a mixture of light and dark nucleus. It's an active nucleus, that's all. Yes, Rahul, it is same, right? So when you go to Robbins, you will see plasma cells in this color also. There are when you go to multiple myeloma especially, you will see plasma cells in this color. Here also, can you appreciate it's a corner nuclei, little bit of light and dark, and also you have the perinuclear halo. This is a stain called as Giemsa stain. So in blood, I don't do histopathology. For bone marrow, we don't do histopathology. In Giemsa, there is no pink color. That's why the cytoplasm is also blue. The nucleus is also blue. Cytoplasm is light blue, nucleus is dark blue, right? So whatever we read here, this structure is for the HNE. In Giemsa, there will be a slight variation. That's it. Fine. Okay. So these are the 5 plasmas, inflammatory cells you want to remember. Neutrophils. In your biopsy will be a bent nuclei. Eosinophil will have granular nucleus, and your lymphocyte will be small, round and blue. Macrophage will have clear cytoplasm, and plasma cell looks like this, right? If you are Instagram favorite person, create this in a story and tag me. I'll reshare it. I want every student in the country to know these 5 things because this is very, very important. Because once a student knows this, it's very, very simple for you to extrapolate multiple things. See, that's it, Rahul. That is about. See, if I'm going to I'll give you a brief explanation of what you asked for. If I understood your questions correctly, right? Arya, which image you wanted? 93, 94 is too far. Can you tell me in which part? Lalit, what do you want me to speak in Hindi? मेरा हिंदी थोड़ा ख़राब है ललित, इसलिए मैं इंग्लिश में अंग्रेजी में पूछ सकता हूँ और अंग्रेजी में पढ़ा है. It's very difficult for me to converse in Hindi. This part, Arya, morphological pattern. Morphological pattern comes after this one. Angrezi, something, leave it. Rahul, antibody, what happens is if my cell also will have antibody, I am earning. I don't spend everything outside, right? So I store something and I'll release something, only few things. Okay. See here, there's more of fibrin. Here I'm not having primarily cells. This pink area is something called fibrinous inflammation. All these are fibrin. That's why it's looking very, very pinkish in color, right? Okay. If this was a question, it's a pink meshwork of fibrin. Okay. And this is a very low power image. If I zoom this, it becomes more cluttered, but it's a serious inflammation, most likely must be eosinophils. It's not looking much clearer to us, right? It's getting smudged, so I'm not able to comment on this. But if it's a serious inflammation, most likely you'll have a little bit of fluid more and few inflammatory cells here and there, right? Is there any other picture? This part, here it's also the problem here is it's becoming little bit more too many cells. So there are lots of overlapping things, so I'm not able to identify it clearly. I'll do one thing. I have slides of all these. You have apps. I do have an abscess slide. I'll give you the abscess slide. Just look at it, zoom it, and zoom out. I'll give you a slide link. If you're in my WhatsApp channel, I'll give you the link of the slide. You can watch it anytime you want. The only thing is this area is too many cells. So the cut section is not showing single cell, it's showing clusters of cells. So only I'm not able to identify this much. Maybe if you go in the corners, can I say, though it's very tough for me to zoom it, it's looking like a bent nuclei, right? Any abscess will have a bent nuclei because abscess is collection of pus. Pus is nothing but neutrophil, fine? These are only 3 images in this. Ulcer, again, I'll show you a better ulcer. If you zoom this in a normal slide, it looks much clearer, right? So tell me whatever you want, I'll definitely do it. Yes, Lalit, I'll definitely try to speak slowly. Sorry for it. Okay? Any doubts in today's class? Let me know. I think if I start speaking Hindi, I'll speak very much slow. So I have to think what I have to speak. Rahul, I'll do it. Leprosy is same about chronic inflammation. If you know chronic inflammation, leprosy is more or less sorted, but I'll definitely try to cover leprosy sometime. Okay. See you tomorrow. I'll be continuing tomorrow with the overview of cellular and your vascular phase of acute inflammation. See you there. Fine. Thank you. Bye-bye.